The world of mHealth continues to evolve and really explode in a lot of respects, and at the same time, still looking in fits and starts to really catch on. So there's an innovation side and certainly a regulatory side here to consider. And with me to talk about all of that is Kaushal, who is the Chief Strategy Officer of West Health, located out here in the San Diego area.
That's right.
So, yeah, nice to have us in your backyard. Thank you.
Thanks for having me.
Chamber of Commerce weather too. So you've really
Always.
produced. Yeah. Well, let's just talk about it. You and I actually, we spoke about this a couple of years ago.
That's right.
I mean, where are we from then till now? What's been going on in the space that gives you encouragement or gives you some positive thoughts that, hey, we're getting somewhere?
Yeah, so I think some key learnings as the years have gone by, and things have evolved. I think an important point is that mobility by itself is not just going to work, it won't get adopted. Healthcare is a really complicated, fragmented ecosystem. So for things to all come together, a bunch of levers have to, I think, move in the right direction, and we're seeing that. So I think the most important thing, first of all, is the payment model. So classically, healthcare has been paid on a per transaction basis. So if you're a hospital, you get paid for what goes on inside your four walls. That's slowly changing. They're getting paid more for what goes on outside. So it suddenly creates incentives to keep people healthier, stop them coming into their hospital. So now what we're seeing in the landscape is that hospitals are changing their clinical processes to optimize around keeping that patient well outside. And then once you've got those two in check, then you can think about all the great technologies that you and I know, mobility, analytics, cloud-based computing, and bundle that into all those clinical processes to keep people healthier.
So I mean, if I interrupt, so you think the payment structure is kind of the underpinning of all this. Once we get it settled as to who is going to be rewarded or compensated for what, that's a huge step in the right direction.
Completely agree. So if there's one thing I could change, it would be the payment model. How do we pay for real outcomes versus just volume? I think paying for volume creates real perverse incentives, not to keep people healthy, but that's changing.
Right, and mobile, that you can get outcomes and you can see real outcomes right there on your device through your measurement on a day in, day out basis.
Yeah.
I would think that's kind of encouraging to consumers, to patients, to see that they have control and they're aware of progress they're making.
Absolutely. And I think going back to the fundamental economics, things have to change. The US spends, around 18% of GDP on healthcare, and we don't get the same outcomes as other countries. So I think there's real hope, given that mismatch. The country will go bankrupt unless we figure out healthcare.
What about the regulatory burdens here? I mean, the FDA has had some rulings with regard to device approval, some general guidelines and what have you, but there's still a lot of gray, it seems like, that it's just not as clear cut as some would like it.
So, really good point. I think innovation is always going to outpace policy. So I can never think of a time where policy was clear cut around the regulation of technology.
Don't tell that to a regulator, though.
It's always going to outpace.
But you're right, you're absolutely right.
But the FDA, like other regulatory agencies, I think have a hard job. So, especially the FDA, things have to be safe. You can't release products out into the market which could injure patients. You've seen the paper. You've seen the front pages of national papers outlining those scenarios, so that can't happen. Right. So they've got a tough job. What is the right risk-reward balance and ratio, etc.
Okay, and then on the patient adoption side, there is, I probably in some respects, some reluctance. I think probably worries about security, privacy, and then maybe. Kind of that, it's the big brotherism, and a few people that is that an impediment to some extent, you think?
So, look, a very simplistic classification. There's things sold directly to consumers. So you've seen all these wonderful apps, these Fitbit devices. Consumers don't worry about that. If it creates value for them, they'll buy it. And we see that world growing year on year on year. The stuff which is prescribed or used via a physician or a hospital, I think there's more concerns around safety and privacy and security. But I don't think these are huge problems. Sensible policy and the right technology embedded can fix those, and is.
How do you, and I mean you personally, I mean you're involved in an industry, and certainly a nascent industry, that has so much innovation occurring, but yet it's still a wide open playing field, and there's a lot of opportunity there. It's almost, I guess I wonder about the patience factor or persistence factor, trying to push that rock up the hill when you know there's a great payoff.
Absolutely. And that's exactly what's going on right now. I think post-health reform, we're seeing a lot of changes in the ecosystem yet to be settled. health reform is pushing through different payment models. We're seeing the payers and the hospital systems innovating a great deal in the landscape and trying using new technology, seeing what works, seeing what doesn't, lots of pilots. And that's all undergoing now, which I think is great. Is there a final answer in terms of this is what's going to work or not? I don't think we're there as yet. I don't think we're far away though.
Okay. So we're getting there.
Hopefully.
Progress.
We have to get there.
Yeah, right.
We have to get there.
Well, it does. Again, it seems like the opportunities are immense.
Absolutely.
And certainly the benefits that we can gain, chronic disease management and so on and so forth. And but good luck at West Health. We certainly appreciate all the work you're doing, and thanks for being with us here on the Buzz Zone.
Likewise. Thanks for having me.